Well, hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we have been very busy for our Labor and Delivery Symposium of 2025. And with me here is today Jessica Irrobali. Welcome, Jessica.
Thank you. Thank you for having me.
Jessica, it's wonderful to have you here. You are, of course, the keynote presentation kicking off our symposium on October 6th, and your presentation is titled Postpartum Education, Leveraging Post-Birth Warning Signs for Improved Outcome. This is such an important topic. I'm so glad you're bringing this topic to us. But before we hop into the topic, tell me a little bit about you and your background, just briefly. I know you said before you don't like talking about yourself, but we want to hear from you.
So a little bit about me. I came into nursing late in my career, actually 10 years late. When I was 23, I was in college and I accidentally found myself pregnant. And so I had to quit college and navigate the healthcare landscape, find some type of insurance that would help me get the prenatal care. So I was late to prenatal care and had some interesting. I had some interesting interactions when I had a baby, and so based on that interaction and based on kind of my history, I went ahead and went into nursing 10 years after I delivered because I thought I would love to take care of women and support women that are going through or patients that are going through their most vulnerable time in their life and be there for them. So, jump 10 years later, I went back, got my associates in nursing. Then I went ahead and fell in love with perinatal education, got an educator to mentor me. So was a high-risk perinatal educator for a long time at a level 4 facility, which does really, really high-risk deliveries. And then I went into quality because I just love quality because you can't change things without any kind of quality improvement. So jumped into quality role. And then there was an opportunity to join the A1 team. And I thought, why not? Why not try to join the A1 team and affect change globally and nationally? And to my surprise,
Before you go any further, for our international audience, can you tell us what is the A1? What is A1?
okay. So A1 is the Association of the Association of Women's Health, Obstetric, and Neonatal Nurses. It's our national organization. We represent 350,000 perinatal and neonatal nurses in this workspace. We go ahead and establish the national standard of care, and I like to compare it to football. Basically, I made it to the NFL, the National Football League of nursing. So I like to compare it to that. And so we impact change. We advocate for change through our nursing education, advocacy, and research. And so I was able to get into the A1 team, and I just feel so honored to be there and just blessed. I got my job, my dream job that I've been looking for. Yeah.
Fantastic. Thank you so much for sharing that. Now, you have been involved in the development of the A1's post-birth warning signs program. Just tell me a little bit about that and how it has evolved over time.
So one of my passions is maternal morbidity and mortality. And so as part of that, was assigned as a lead for the post-birth warning signs. And we were able to get several grants for mothers. We're very fortunate. And we were able to blow it up. So post-birth warning signs had already existed before I got there. And I saw this program as a way to involve all of our colleagues from different departments to recognize maternal mortality or recognize post-birth complications early. Because if you look at the statistics on maternal mortality, most of it happens in the post-birth or postpartum period. And so I thought it was really important to involve all our ED colleagues, our ICU colleagues, our doulas, our lactation consultant, all the community to help with post-birth warning signs. And so with these grants, we were able to do research and listen to women who have experience getting this postpartum education and enhance it so that we can make it more accessible and readable to all patients, right? So
Absolutely. I find it fascinating and such a wonderful program because, as you mentioned, it is for everyone. It's not just for healthcare providers and nurses and such, right? This is something that everybody can access. We can utilize it in educating the families we serve and the community. Is that correct? Talk a little bit about that aspect, Philippe.
Yes, I think it's really important that we get all community stakeholders, all different people constantly assessing our patients because they don't know what they don't know. And if we know and we can help them navigate the postpartum period and get them the help that they need, we can reduce the maternal mortality worldwide. And I think using this education, educating yourself, and then educating and re-educating, I compare it to like a basic life support class or advanced
Mhm.
life support class or a stable class. We take these classes as clinicians every single time because we want to be reminded. Think about the patients. The patients don't really get this education over and over. So we need all of our community partners to help with that education and to assess patients and make sure that they're all right because they don't know, right? And I know I'm a terrible patient and I try to minimize my signs and symptoms. So I can just imagine
Mhm.
somebody else who's not a clinician.
Yeah, and absolutely, and you are so right. This post-birth warning sign program is so important because, um, let's say the family is discharged, or the mom baby discharged from the hospital, and then what happens then? Then there is a time of before the family is being seen or the woman is being seen again, right? For a postpartum visit, there is some time. So it is important, A, that the family has that education, and B, that others have that education. The lactation consultants, the doulas, the postpartum doulas, the family, right? Because it really prevents things falling, signs and symptoms falling through the cracks that are so important. And as you said, you're a bad patient yourself, and women are like that, right? Where we don't want to make a big deal. The baby is the most important thing, and we feel like, oh, we need to push through this. So there is often signs that are very serious, but maybe not, being um, seen as such because, everybody just, wants to go on and doesn't recognize the signs, right?
Hmm. Well, and they don't wanna move or change anything in their day. Because if you validate and you admit that you have a sign and symptom, you have to go and get help. You have to leave your newborn infant, or if you have an early loss, you have to leave wherever you're feeling the most safe to look for help. So I think equally, post-birth warning signs not only gives the tools to recognize for the friends, family, doulas, but then also empowers patients to seek help and to ask for
Yeah.
help. And then when clinicians understand like what's going on in the postpartum period, the pathophysiological signs, and why they're so crucial, then they can also respond, manage, treat, and not dismiss and discharge, right? So,
Absolutely. Last question here for you. Discharge in the hospital is often rushed, and there's a lot going on, right? Because paperwork, birth certificate. There's so much that needs to be done. So, how, as clinicians, can we improve that? And I hope this program also helps with the education and the discharge. Correct?
yes. So, one of the things in our presentation is doing discharge education early. I'm actually also utilizing my DMP project because I want to start discharging education like at the 28th week. There's no reason why we can't do it in the clinic. There's no reason why we can't do it in bits and pieces throughout the entire admission process, during pre-admission, during labor, during postpartum. And there's no reason why our doula friends and our lactation friends can't go back when they're doing their house visits and going over the education again. And then when they come to the ED for help, there's no reason why the ED can't go over the education again. I think the study shows it takes 8 times for an adult learner to hear something to be able to absorb it. So I can't even imagine I can imagine what they're feeling through discharge. They just went through something that is comparable to like something physiologic, right? Like running a marathon. They're exhausted, they're sleep deprived, and they're learning so much, not only about their newborn, but exactly what's going to happen
Mhm.
about them. It's overwhelming. So we really need to prepare these patients to go home to realize everything that can happen to them so that they can get help and so that we can together decrease maternal mortality in the entire world.
Wonderful. I love how everybody can get involved and make a difference. So thank you so much. Before I let you go, any final wise words for your viewers that you're hoping this presentation will bring to them?
Um, the The biggest wise words is, I think, the quote from Maya Angelou, they might not remember your name,
Mm,
but they will always remember how you made them feel. So just remember people are vulnerable and people are
mm.
people and they're going through their day. And when they're coming, just sitting down, having a chat, taking a listen, and then possibly saving their life, I think is the biggest takeaway that I want people to take from this presentation.
Beautiful. Well, thank you so much, Jessica Irrobali. It has been such a pleasure having you here today, and I'm looking very much forward to your presentation.
Thank you. I'm thrilled and honored. Thank you for having me.
And here's some brief information for our viewers now if you would like to find out more about this presentation and all the other presentations in the symposium. We invite you to go to goldlearning.com and please sign up for this free keynote presentation here with Jessica Irrobali, which will be live on October 6th at goldlearning.com. You can sign up for that as well. Share the link with your friends and colleagues in the field. And also, this presentation is recorded. So if you're not available on October 6th, you will be still able to watch the recording at a time that's convenient for you. Thank you, everyone, for watching. And I hope to see everyone at the keynote presentation. Bye-bye.